Vision is an essential part of our lives. Much of what we do depends on it, and much of what we enjoy can be enhanced by it. So if vision begins to fail, it can be a cause of great anxiety. An understanding of what is happening with our vision can give us a sense of control over the situation and some peace of mind. One of the leading causes of vision loss in people over 65 is a condition called age-related macular degeneration, otherwise known as AMD. To understand how AMD affects our vision, it's important to understand how the eye works. Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, a light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina and the macula. The macula is a small area at the center of the retina. The peripheral retina is the large area surrounding the macula. It's the peripheral retina that gives us our side or wide-angle vision. It is the macula that gives us our pinpoint vision and allows us to see detail clearly, helping us to do things like drive, read, or recognize a face. Age-related macular degeneration, or AMD, is a deterioration of the macula. When the macula doesn't function correctly, your central vision can be affected by blurriness, dark areas, or distortion. This condition affects many people as they get older.
AMD is the leading cause of vision loss in people over 65. The two forms of AMD are called atrophic, or dry form, and exudative, or wet form. About 90% of patients who get AMD have the dry form. The retina is made up of many layers which are sandwiched together into a smooth surface. These layers function together, allowing us to see clearly. In patients with dry AMD, the layer we call the retinal pigment epithelium, or RPE, is disrupted by deposits, or drusen, and other age-related changes. These changes may cause vision to deteriorate. With wet AMD, abnormal blood vessels grow in the layer behind the macula. These blood vessels leak fluid which further blurs or distorts the central vision. Wet AMD occurs in about 10% of all macular degeneration cases. The most important factor in treating wet AMD is early detection. For some people with wet AMD, there are treatments available. We shouldn't think of these as cures, but the progression of blood vessels can be stopped. If these abnormal blood vessels are left unchecked, they could lead to significant loss of central vision.
Macular degeneration is a common problem for people as they age. While we do not know how to prevent or cure this condition, we are learning more about it. For instance, we know AMD often runs in families and is less common among African Americans. Some studies have shown that people who smoke or have high blood pressure may be more prone to developing AMD. We also know that a certain combination of dietary supplements can be beneficial in some cases. Researchers are also evaluating new forms of medical, surgical, and laser treatments. In general, there is little we can do to improve the eyesight of someone who has AMD, but with early detection, we can often help preserve their vision. Monitoring an Amsler grid at home, regular dilated exams, and seeking care immediately if there are new symptoms allows for earlier detection and better outcomes in many cases.